I can see it from both ways because even though I'm involved in the administration of our platform, I practice medicine full time. I'm in the trenches much more actually than I am in the administrative work. So I'm dealing with my partners and colleagues every day in our office and in our ASCs. I hear it from both sides of the story. Change is always a uncomfortable thing for a lot of people in general. And definitely there is a change when you join a MSO. There is a perception that lose control over your existence. And I really don't think that that's fair. I think in the day-to-day routine from physicians, there is not much change if you really analyze it. There's been some financial issues because especially when a platform is starting, that there's infrastructure costs that are paid from the physician. And in the last few years, I really think a lot of the unhappiness financially when physicians joined an MSO was the confluence of not only the infrastructure costs, but we got hit with a lot of things that happened with COVID at the same time over the last few years. There was a big labor correction that happened a few years ago when a lot of physician practices had to increase, probably justifiably so, to keep our MAs and our techs and our nurses with us when McDonald's and so forth were offering big bonuses. That labor correction would have happened whether you were affiliated with an MSO or not, for your practice. But that hit the same time. Plus, expenses went up during COVID. All our products, even gloves and gowns, became incrementally higher costs, and those have not come down at all post COVID. So you had these increasing expenses that happened at the same time as the physicians were helping fund the infrastructure buildup of their MSOs. So I think that exacerbated the financial issues. But a lot of groups now, what they call income repair, are seeing that, and a lot of that's due to better payer contracts, economies of scale that would have only happened with a large organization and cannot and does not happen with a small group that's unaffiliated.